I want to go to a video question now from a viewer, and this is Carrie Starr. Love the last name. Let's take a look.
Hi, my name is Carrie Starr. I have a few questions about a breast augmentation. I'd like to see which one is the safer implant to get, the saline or the silicone. My next question is, I'd like to see how long the recovery time is, and also how long do the implants last before you have to change them? Thank you.
That is a great question. So let's take the first one, doctor. Saline or silicone?
So both saline and silicone gel-filled implants have a very good safety record. They are both fully approved by the FDA. If you look intuitively from a pure safety standpoint, the saline-filled implants are a silicone shell, almost like a balloon, if you will, filled with saline or salt water. If those leak, the only thing that comes out is salt water, and they'll deflate. So a lot of patients make that argument for choosing saline implants from a safety perspective. However, I'm very, very comfortable putting in the silicone gel implants. Way more patients have the silicone gel implants than the saline implants, but it really has to be your own comfort level and what you are accepting of having in your body between these two types of implants.
I'm going to actually follow up on Carrie's first question. Does one look better than the other, or are they comparable?
You know, my personal bias is that the silicone gel-filled implants have a more natural look and feel to them. The saline implants are also very good devices. They tend to be a little firmer, and they also can have more of a rippling effect. That is, as the water settles down, because it's a little greater density than the silicone, it can cause a little bit of rippling in the upper part of the breast implant, and sometimes that can show through the skin and be visible.
What is the recovery like? I'm assuming she wants to know how long maybe the pain may be there, when she can get back to normal, do exercise, things that women all do.
Sure. It's a relatively easy recovery for most of our patients who have that operation. They are in and out of the hospital the same day, and they're doing most of their daily activities within a couple of days. I have my patients stay out of the gym for a few weeks afterwards to really let everything heal up before they do any upper body work. But the recovery is really not terrible from that. A lot of surgeons are doing that operation with minimal or no narcotic pain medicine afterwards. So it's a recovery it's not terrible and very well tolerated by most of our patients.
And she wanted to then know how long, I guess, the implants will last till you have to either do, I guess, an update.
Sure. So they're not really like the tires on your car that have to get rotated every so often. The implants last they can last for a very long time. What can happen with implants? Well, they can leak or rupture, and if they leak or rupture, then obviously we're going to go in and replace them, or at the very least take them out. But in the absence of any leakage or the formation of a scar contracture around them, we call that a capsular contracture. The body sort of walls off the implant and squeezes that implant and changes the shape a bit. In the absence of either of those things, they can last a very long time. And I've taken care of women who come in their late 60s and even 70s that have had implants for over 30 years. And for some reason at that point, they want to take care of them, change them, or take them out. But we've seen women carry the same implants for many decades without problems.
So I'm glad you mentioned that, because I was wondering, are there some women after they have the procedure years later say, you know what, I'm done with this. I don't want it anymore. That's no problem?
Absolutely. That happens all the time. And you have to consider that once you put implants in, that yes, there's a pretty good likelihood that somewhere in your life later on that you may decide that you want them out or you want them changed. Your body type might change with weight gain or weight loss. And so there's a pretty high likelihood that you'll want to do something in the future once you have implants placed. And that's a consideration.
Fantastic. Okay, doctor, we have another question from Sheila, and let's see what she writes. This is not a video question, so we'll read it. Why do I have dark spots under my eyes? So I'm not sure if she's meaning dark spots or if it's dark circles. Maybe we can address both of them in case it's one or the other.
Sure, sure. So that's a great question, Sheila. And sometimes those really are dark spots, and they can be addressed with some bleaching creams like hydroquinone. But a lot of times, those dark spots are really caused by shadowing. And a lot of people will get some hollowing out under the eye in that region, and they'll get what we actually call a tear trough appearance, or a tear trough deformity. And for many patients, we can make a huge difference by putting some filler in that area and sort of changing the shape of the tissues in that area a little bit, giving a little better appearance to the eye. And then that takes away a lot of the shadowing and makes things look a lot better. And that's one of the very, very popular procedure for a lot of my patients as they get into their late 40s and 50s to change that appearance under the eye. As we age, unfortunately, we lose volume in our face, and gravity takes the tissues down a little bit. So it's often, again, not so much that it's a dark circle, but it's shadowing, and it's a change of appearance in the face that leads to that.
All right, doctor, thank you. We have a few minutes left in our show. I want to get to this viewer question from Sutton, and this is what they ask. What are the risks of going under anesthesia? Are there different forms of anesthesia? I ask this because I'm undergoing rhinoplasty soon and would like to know the best route possible. Thank you so much for that question.
That's a great question. The risks of anesthesia, there are many, many risks to anesthesia. And that's why we have anesthesiologists. That's why we have trained professionals who administer anesthesia. And they're going to do a very careful evaluation in your particular case and make a recommendation. For rhinoplasty, in all likelihood, your surgeon's either going to recommend general anesthesia, where you actually go to sleep completely, or twilight anesthesia, where you have very heavy sedation for that, along with local anesthetic. And the important thing is that you want to have a really good evaluation by the anesthesiologist. You want to tell them about all your allergies, all your medical problems, and discuss the risks and benefits with the anesthesiologist. Sometimes a general anesthetic is actually safer because your airway is better protected during the procedure. So, anesthesia can have multiple risks, and you want to make sure you have a good assessment so that it's done very, very safely. When we talk about patient safety, there are three components that are very, very important. There's the surgeon, who's doing the surgery. Is that person skilled? Are they well trained? Are they board certified? Then there is the facility that you're in. Is that a qualified facility? Do they have all of the emergency equipment? And then there's the patient. And every patient may have some different medical problems. We have people who are really super healthy undergoing cosmetic procedures, and we have people with some medical problems that can pose extra risks. So all of those three components work together. The evaluation by the trained surgeon and the anesthesiologist working with that surgeon, nothing can replace that, ensure that your safety is protected.